You're turned on, you're having sex, things are going great, but somewhere in the middle of sex, you lose it. And when you lose your erection, you feel embarrassed, frustrated, and maybe you even start avoiding sex in the future because you don't want it to happen again. I'm Dr. Rena Malik, urologist and pelvic surgeon, and I want you to know this is one of the most common things men come to see me about. And today I'm breaking down exactly why this happens and what you can do about it. Stay until the end because some of these things genuinely catch my patients off guard. But before I get into it, if erectile dysfunction is something you are already dealing with, I created my erectile mastery course specifically for you. It's the exact roadmap I walk my own patients through in my urology practice. We talk about the real causes, the proven treatments, and the lifestyle changes that actually make a difference. Check it out at learn.renamalikmd.com/erectile mastery. First, let me explain how an erection works. An erection begins when your body has the parasympathetic nervous system activated, your rest and digest state. When you're aroused, your blood vessels and nerves release nitric oxide, which is the ignition for erections. Now, this basically is a signaling molecule that tells your arteries to relax and widen. This means that blood can now rush into the penis, into those spongy tissues called the corpora cavernosa, allowing it to expand both in length and width. And at the same time, tiny valves in the veins that are around the penis close off, trapping the blood inside and creating the pressure that's needed for the erection to sustain. Now, whenever there's a problem in this cascade, meaning that either the blood vessels are unhealthy, the nerves are not releasing nitric oxide, they're not relaxing well enough to allow blood flow in, or the veins are letting blood flow out too quickly, all of these issues can cause it to become difficult to maintain an erection. Now let's go over the 6 reasons you might be struggling with erections. Reason number 1 is an underlying vascular or hormonal issue. If you guys have been on my channel before or watched any of my content, this is not news to you. You guys already know this. The number 1 cause of erectile dysfunction is vascular. But the more important thing that I want you to know is that when you start having issues with erections, it can be a sign of a serious medical issue. In fact, men who get diagnosed with erectile dysfunction, 14% of them, which is not a small number, have a heart attack 7 years later. And this is because erectile dysfunction is a canary in the coal mine, basically a warning sign that you have to pay attention to your body and your heart health. And this is because the blood vessels to the penis are about half the size of the blood vessels to your heart. So when you start having problems with your blood vessels, like plaque buildup or the vessels are not as healthy, you're going to see the problems in your penis first. And many issues like high blood pressure, high cholesterol, and diabetes affect the health of the blood vessels. And these are usually silent diseases that you don't know unless you get checked. So the most important thing, guys, the number 1 thing I want you to take away from this video is if you're having trouble, get evaluated by your primary care doctor and make sure you don't have any of those silent diseases. No high blood pressure, no high cholesterol, no diabetes. Also, get your testosterone checked because low testosterone can affect erection quality. And it's so simple to get it checked. It is an early morning blood test before 10 a.m. and tells you what your number is. Guys, I like to say erections are a window into your health or a biomarker. If something has changed, it is so important to see a physician. This might be the most important appointment you make in your entire life, even if you're a young man, because a lot of guys are told it's all in your head. It's not always in your head. But reason number 2 is your brain is not cooperating. Guys, I tell all my patients that the first time you have a problem with erections, it's also in your head because you're going to think about it. You're going to remember, oh, I had an issue. And the next time you try to have sex, you're going to think about it. But your brain is the most important sexual organ you have. Not your penis, your brain. The moment you start thinking about, oh my God, am I going to lose my erection? Am I doing this right? Why isn't she orgasming? Or whatever the case may be, that distraction activates your sympathetic nervous system, which is the opposite of your rest and digest. It's your fight and flight response. This constricts blood vessels and makes blood leave the penis. Really important to make sure that your brain is in the right place. Now, performance anxiety can be a vicious cycle because you are stressed about performance for whatever reason, and then because of the stress, you either can't get an erection or can't maintain it, then you get more anxious, and then again you can't have an erection. It just cycles worse and worse and worse until you're completely in your head. But this is something that we can deal with. You have to talk to your partner, consider seeing a sex therapist if you're really struggling. And I often tell patients, take sex off the table. Be intimate without penetration. That means touching yourself, touching your partner, maybe not even touching genitals right away. And then over time, as you start feeling more confident, you can start touching genitals. And then again, over time, eventually you can go back to penetration once you're not stressed about the ability to get an erection. Oftentimes medications can help here as well. I often give patients a 5 milligram dose of tadalafil, which you take every single day. This is a really low dose medication, and it can help just sort of give you that little boost of confidence to get your erections back. And then once you feel confident again, you can stop the medication or continue taking it, whatever you prefer. Now, reason number 3 is decreased penile sensitivity. As men age, the nerve endings that they have that basically tell the tissues that, hey, you're touching me, become less sensitive. And so your nerves send less signals to the brain that allow you to become aroused. And once you're not as aroused in your brain, your erection follows. This may mean that how you have sex needs to change. When you think about the spinal cord that's sending signals to the brain, we typically rely on the area of the spinal cord that sends touch signals, like, oh, touching this area, regular touch. But there's also other areas of the spinal cord. There's vibration and there's temperature. So using vibration with toys, or using temperature like warming or cooling lubricants, or also using light touch like a feather or other different types of stimulation like a scarf. These sorts of things may help stimulate the area and help increase arousal and add novelty. All right, reason number 4 is you're just not fully aroused. Now, for some people, this might be like, what do you mean I'm not aroused? Of course I'm aroused. But men are sort of expected to get an erection immediately and be good to go right away. But the reality is, guys, you're not a machine. You need to be mentally aroused and physically aroused. And sometimes you may actually be rushing through and not have a full, firm erection. And especially if you're having sex the same way every time, or your partner is rushing you through sex, you might only really get a partial erection. So incorporating more foreplay and novelty can be super helpful to make sure that you reach peak arousal before you start having penetrative sex. Reason number 5, your medications. Many very common medications have side effects that can affect erections. And most men are really never told this when they're getting prescribed these medications. The most common ones are antidepressants, particularly things called SSRIs. These are the most common medications that cause both low sexual desire and, as a result, erectile dysfunction and even difficulties with orgasm. Beta blockers that are used for blood pressure and heart conditions can also make it more difficult to get erections. Even certain antihistamines, particularly older ones, can make it difficult to obtain erections because it actually interferes with the parasympathetic signaling that's required for erections. Lastly, finasteride, which is used for hair loss as well as enlarged prostate, has sexual side effects as well that can affect erectile function. Now, these are medications that don't affect everyone the same way. In fact, these side effects happen in like less than 1% in some cases. However, the issue is that some people really do struggle even after they stop the medication. So please talk to your doctors. Always let them know that sex is important to you and you want to make sure this medication has no sexual side effects. If you're on any of these medications, make sure to tell your doctor, but don't just stop them because some of them can be really important, especially if it's for high blood pressure or depression. Stopping them prematurely can actually make you worse in the short term. Now, I've talked about these medications before on this channel, so make sure to check out my videos on medications that can cause erectile dysfunction or sexual side effects, as well as SSRIs and finasteride. But guys, in most cases, there are alternative medications, dose adjustments, or other strategies that you can use to help. But if you don't bring it up with your doctor, you'll never know. Number 6, and this one's really not talked about enough, it's sleep apnea. Sleep apnea is one of the most underdiagnosed causes of erectile dysfunction. Sleep apnea basically causes you to have repeated episodes of oxygen desaturation, meaning you're not getting enough oxygen through your body throughout the night. Your body responds to those drops in oxygen by releasing stress hormones, cortisol and adrenaline, which vasoconstrict or narrow blood vessels and then suppress testosterone production, which again is really important for sexual function and desire. Over time, this creates exactly the vascular and hormonal environment that impairs erectile function or makes it difficult to get an erection. And guys, we've seen this over time and time again that men who have higher rates of erectile dysfunction when they have obstructive sleep apnea compared to men who don't have sleep apnea. And the research has shown that when you treat sleep apnea with CPAP or continuous positive airway pressure therapy, it actually improves erectile function in a meaningful percentage of men. As I mentioned earlier, OSA is very underdiagnosed and undertreated, so you have to know that you might be at risk. Now, what are the risk factors? So if you are overweight, particularly if you have a lot of weight around the neck, or you have a neck circumference of greater than 17 inches, this can put you at risk because the fat deposits around the throat directly block your airway during sleep. Also, people who smoke are 3 times more likely to develop sleep apnea because they have increased airway inflammation. Also, if you use alcohol quite frequently, it can relax the throat muscles, making it more likely that they're going to collapse during sleep. Other metabolic conditions like high blood pressure, type 2 diabetes, and chronic nasal congestion, or if someone's told you your airways are narrow, that may put you at high risk. And if you snore really loudly, or you wake up exhausted no matter how long you slept, or your partners notice that you stop breathing during the night, these are real signs that you may have sleep apnea and you should get evaluated. And guys, a sleep study is pretty straightforward, and nowadays you can even get them done at home. So talk to your doctor about it because maybe you don't want to go into a sleep lab. Treating it will improve your erections as well as your testosterone, your cardiovascular health, your brain function, and your overall longevity. So the bottom line for all of this is that losing an erection during sex is really common, and it's important to understand why it's happening so you can fix the underlying cause and at least prevent it from getting worse. Please, please, please don't suffer silently. See your primary care doctor, see a urologist, because you deserve it. You deserve a real evaluation and real answers. And as always, remember to take care of yourself because you're worth it.